In other news tonight, it's officially been 3 years since the COVID-19 pandemic flipped the world upside down. The Pan American Health Organization, an agency that remains at the forefront of the battle against coronavirus, holding a press conference on this significant date. They warn that even though the world has somewhat adjusted to the virus, it can be ever-changing. And they also weigh in on how they think the Bahamas in particular handled the virus. Our Tyler Simonet has more in this report.
On March 11, 2020, the World Health Organization declared COVID-19 a pandemic. At that time, businesses, schools, and shops closed down, streets were empty, and the world remained unsure of what the virus would bring. Now, 3 years and some 190 million COVID-19 cases and 2.9 million deaths in the region later, many are of the view that the world has adjusted to the pandemic. Newly elected director of the Pan American Health Organization, Dr. Jarbas Barbosa, warns that we are not out of the woods just yet.
As we learn to live with this virus, countries must first maintain and continue to strengthen surveillance. We know that COVID-19 can evolve and adapt quickly. The risk of new variants is real. Testing rates have dropped, but we must maintain monitoring and report this information to PAHO and global mechanisms. Second, we need to continue implementing COVID-19 vaccination programs, reaching out to the 30% who have yet to receive their primary series. So we have, unfortunately, many millions of people that haven't had access to the first doses of COVID-19 vaccine yet in our region. That is a challenge.
According to PAHO, while incidence rates are 20 to 30 times lower than a year ago, last month the region reported 1.5 million new cases and 17,000 deaths. Dr. Barbosa added that setbacks throughout the pandemic have revealed weaknesses in many countries' health systems, including the declining rates for routine vaccination and the treatment of non-communicable diseases. He pushes the region to get behind producing our own medicine.
Latin America and the Caribbean still import 10 times more pharmaceutical products than it exports. Strengthening regional capacity to produce mRNA vaccines, for example, can help our countries to better manage COVID-19 and other emergencies in the long run. We have the tools to end the COVID-19 emergency, but we need to continue working if we want really to have the complete control and to stop the transmission in the near future.
And when it comes to how the Bahamas handle the COVID-19 pandemic, PAHO officials weigh in.
The Bahamas has handled the situation of the COVID-19 pandemic in a good way. All the analysis and the joint work that has been done has resulted in the quickly adaptation of the necessary measures at all levels, both to reduce the risk for the population and also regarding how to open borders as well as the distribution of vaccines. Regarding the tourism, further analysis is needed to assess the impact on tourism and other economic sectors that will provide key information in order for the country to look at it. So in general, all the handling of the pandemic has shown that the Bahamas did well, as I said.
Tyler Simonet, Eyewitness News.